Everyone, thank you for attending the January 2025 webinar series, the Data Reporting and Monitoring series. I'm Alvin Batista. I will be your moderator for today. January 2025's presentation will be on Managed Care Program Data, also known as MCPD, updates, and ECM, CS, CCM, JSON exchange. Next slide, please. Once again, I'm Alvin Batista. I'm the Research Data Specialist 2 over in Managed Care Data Support section, and I will be your moderator for this month. Next slide. Today's agenda, we will have the three following topics: Managed Care Program Data, also known as MCPD updates, ECM, CS, CCM, JSON exchange, and documentation and general testing information. Next slide. So we have a DHCS staff joining us today. Speakers will be Kelly Mendenhall, Susanna Bishop, Janet Otto, and Jeff Jennings. And of course, we have our wonderful webinar team support, as you see listed on the right side of the screen. Next slide, please. For questions and answers, for any general questions, please submit your question to the WebEx chat. And please ensure that your questions are visible to all participants, because the host, myself, is not monitoring.
Is Alvin muted?
Am I muted? I'm on.
No, I can hear him.
Okay.
No, we can hear you.
Yes.
Alvin.
Cool. Thank you. Just a reminder for those that are not speaking, please mute yourselves unless you're part of speaking as well. But thank you for letting me know whether or not I'm muted or not, but I am on right now. So going back, question and answers. For general questions, please submit your question to the WebEx chat, and please ensure that your questions are visible to all participants, because I, or the host, and people are not monitoring the private chat. For specific questions, please reach out to the appropriate data mailbox, as will be instructed closer to the end of the presentation. Next slide, please. So before we move on, today's webinar, just a reminder, is being recorded for documentation purposes. The recorded video, script, and presentation materials will be uploaded to the Data Reporting and Monitoring webinar series, and that link below takes about a couple weeks for the slides to be uploaded. The glossary and FAQs are also updated regularly every month. Next slide, please. All right, so first up will be a presentation on Managed Care Program Data updates. Doing this presentation will be Susanna Bishop and Kelly Mendenhall. So I'll hand it over to their team. Thank you.
Thank you, Alvin, and good morning, everyone. My name is Kelly Mendenhall, and I'm a section chief with the Managed Care Monitoring Branch within MCQMD. And today we're here with you to talk about some forthcoming updates to the Managed Care Program Data, or the MCPD. We do want to thank you for those of you who gave us feedback on future iterations of the MCPD. We'll take all of those future grievance suggestions into consideration. But hopefully your teams are already aware of these changes that we're talking about today. We have a few slides to go through, and then we're happy to take questions at the end before we move on to the next presentation. So with that, Susanna on my team will be taking you through the slides, and I will hand it over to Susanna.
Hello, thank you so much, Kelly, for the introduction. So if you are not familiar with the MCPD, it is the Managed Care Program Data, and it includes submitted data by the managed care plans in the areas of grievances and appeals, continuity of care, out-of-network requests, and medical exemption requests. But specifically, we would like to inform you of changes happening with the grievance and appeal data. The changes are a result of federal reporting requirements and SB 923, the Gender Affirming Care Bill. They will take effect March 1st, 2025. Next slide, please. Thank you. We first communicated the upcoming changes with plans back in December, including the technical documentation. We did ask plans for feedback, as Kelly mentioned, and we do want to thank everybody who followed up. We are currently reviewing all that information that was sent over, and it is being considered for future updates. Next slide, please. So we're going to discuss the appeal type changes first. Currently, plans report grievances and appeals using two categories, benefit type and grievance type, which help categorize the types of issues being reported. We will now make a distinction between appeals and grievances. Instead of using grievance type for both areas, plans will report appeals using the category appeal type. Grievance type will be used exclusively for grievances. The benefit type category will remain and will be used for both grievances and appeals. Appeal type is actually already a data element, but it only indicates if the appeal is denied, deferred, or modified. We are going to continue to collect this information, but under a new category called appeal reason. The new appeal type aligns with 7 federally defined reasons for an adverse benefit determination, and it ensures our reporting is consistent with federal standards. It also provides clarity in the reporting. Next slide, please. And so because of the appeal type changes, we are removing some of the grievance types as they are actually federally defined as appeals. We are also removing a few grievance types that are essentially duplicates, and they are related to long-term care services. Plans should report these grievances using an LTC benefit type instead. Next slide. We have also made some additions to the benefit types. We have added a new benefit type called gender affirming care. This change is in response to SB 923, which mandates expanded access to gender affirming healthcare. We do understand that this is not a Medi-Cal benefit, but we are adding it as a benefit type rather than a grievance type to allow for more specific and accurate reporting when it comes to understanding whether the grievance is related to issues with the plan or the provider customer service. Another addition is transplants, which we've added because of the carbon of the transplant benefits. Next slide, please. And we're also adding a new benefit type for continuity of care. We've introduced this to better differentiate between the continuity of care grievance type, which is for issues related to providers. This benefit type should be used in tandem with the appeal type to ensure proper categorization, of these cases. And this addition does not change the reporting of COC requests. So that is actually the end of our presentation, and we're happy to answer any questions.
And I do see one question in the chat or comment saying they don't see the grievance type removed from the appeal record in the MCPD technical documentation from December 2024 in the description of changes. So I'll have to take another look at that. We definitely want to keep the grievance type to grievances and the appeals type to appeals. So that should have been reflected in the MCPD, but I'll have to take that back and take another look. Any other questions before we move on to our next speaker? And if there are questions that come up at the end, we will stay on for the end of the presentation as well.
Yes, and thank you, Kelly and Susanna, for your presentation. So yeah, if you see any questions pertaining to your section, like you did, Kelly, just go ahead and answer them in the chat as well.
Will do. Thank you.
All right, so just a quick check. Can you guys hear me? Give me a thumbs up if you can. Cool, thank you. All right, so going on to the next section. Next slide, please. All right, so next up will be a presentation on ECM, CS, and CCM JSON exchange, and I would like to introduce Janet Oto. Thank you.
Hi, can everyone hear me? Okay, great.
Yeah.
All righty. Okay, so next slide, please. All right, so as most of you know, we are going through the ECM CS CCM JSON exchange. It's the first of its kind to change the Excel template document into a more modern machine readable format. And currently we're in phase 3 and we are in the enhanced care management ECM care manager and provider facility details. Here we have phase 4, which is going to be coming up, which is also community supports the CS member level utilization details and closed loop referral CLR reporting. Also in there will be the enhanced care management ECM CLR reporting and presumptive authorization. Also the enhanced care management ECM lead care manager details and complex care management CCM lead care manager details. So during this period, as we collect the JSON data, we are still collecting the QIMR Excel simultaneously, and we'll be continuing to do so. And I know a lot of managed care plans were wondering, like, when is it going to be turned off? Eventually down the line, when we feel that, you know, the JSON is pretty much has the correct information and mimics the QIMR, we're going to be doing data quality checks. Then once we feel comfortable that it's good quality and mimics the Excel document, we will then let the managed care plans know that we will be turning off the QIMR. But that's still down the road, so please don't worry about that. Next slide, please. Okay, so as mentioned, here's some important information regarding phase 3. We are currently in there right now. As I mentioned, we do have the care manager, provider, facility details. The testing and staging period started in December 2024, and the managed care plans report November 2024 data to DHCS by 12/10/2024 deadline. And then production starts in February 2025, so we're right around the corner where managed care plans will be starting to submit their production data. And this will be the January 2025 data that will be due on the February 10th, 2025 deadline. Next slide, please. Okay, so this is phase 4. As mentioned, we have the community supports, the member level utilization details, and the CLR reporting. And a lot of managed care plans have been asking, well, how are we going to be reporting this? Because technically it's not due to DHCS until July 1st, 2025. So you won't be having to report this to us. This will be in your August 10th, 2025 submission, which will have the July information that you will be submitting the CLR data. So if you have any other questions, I have an email that you can send questions to. I'll share later. So we also have enhanced care management, CLR reporting, and presumptive authorizations in there as well. The testing staging starts May 2025. So managed care plans will report the April 2025 data to DHCS by May 10th of 2025. And then our production will start July 2025, where managed care plans will report your June 2025 data to us by July 10th of 2025. So as mentioned, managed care plans do not report the CLR data in June submissions. Managed care plans will submit the CLR data in the July submissions, which is due to DHCS by August 10th of 2025. Okay. All right, next slide, please. All right, so here we have a list of important resources. So also for phase 4 upcoming, you'll find the updated resources in there as well. But currently, because we are not in phase 4, we have all the phase 3 information in here. So if you go to the documentation center, you can get the technical document, also the data dictionary in there as well. Also, there is a schema in there for what phase 3 is supposed to look like that will help your technical team to identify how things should be reported to us. If you don't have access to the technical documentation center, you can always contact the data exchange at dhcs.ca.gov email. But if you have any questions about the ECM, CS, CCM, JSON exchange, you can email the EDM data support mailbox there. And then, as mentioned, phase 4 is still coming down the pike. We will be sending out a draft technical document like we have been for the other phases, and also the data dictionary to the managed care plan sometime around February for feedback. Next slide, please. Okay, so if there's any questions, please place it in the chat, or you can email the EDM data support mailbox. And now to our next speaker.
That would be me, Jeff Jennings. Just want to make a couple of comments. We are seeing the excellent questions in the chat. We try to answer them during the session. If we can't, we'll follow up. I just want to comment on the MCPD final. The draft is pretty close to final. There may be, or what you received is very close to final. We put it out for feedback. We make final adjustments based on that. Then we publish the final. That should be available very soon. I will try to share that documentation availability date. Actually, the draft itself is posted out to the documentation center. So you can go out and review it now. And as I said, we'll update everybody on when that final is available. And one other item before I proceed, we know that in some cases, trading partners are not able to access the MS Teams-based DHCS documentation center for various reasons, company policies, and of course, like with every Microsoft product, we are learning as we go. It's got characteristics that are not necessarily expected or documented. So we're looking at a solution that will allow trading partners who can't access the doc center to get to the full range of documentation. Even email is a little bit of a challenge with updated email security policies in place for almost every organization. Certain file type formats are not allowed to be emailed. And so that's one of the reasons we're working on a solution aside from the doc center. Okay, next slide. Why don't we dive into the slides here? So a little bit about testing objectives and support. For the most part, we as a department do not support testing in the sense that we do not review each submitted test file. We do not necessarily have test criteria or thresholds when our trading partners are testing new or updated files. We will answer questions, of course, as always, and respond to any anomalies that are noted. Testing is primarily available for, oh, and I'm just going to interrupt myself. Thank you, Portia. Yes, if the final went out on Friday, then that should be accurate. But I'll double check on that and confirm that should be the last one. As I said, occasionally we run into a last minute change, but generally those are very minor. So it is accurate. To go back to the testing, test environment is essentially available for our training partners to test any file at will. So it's more about testing your own systems against ours. As I mentioned, we do not, as a rule, assess or review submitted test files unless it's for a specific type of program which has already been announced. If you do have questions about errors with these files, please email EDM Data Support and we will follow up with you to make sure that that's handled. Why don't we go to the next slide? All right, so the current files that are in test are the MCPD 3.05 and the ECM CS CCM Phase 3 files. They can be submitted to the PACES test environment. And a word on testing and production deployments. Testing deployments are usually made well in advance of production deployments. The test environment is an exact copy of the production environment, so it allows trading partners to test ahead of time and make adjustments, things like that. So for the currently the changes that are in flight here, the stumbling on that one. The MCD, that document's going to be available. Sorry, it looks like it got turned around. MCPD test changes will be available February 1st. So that's going to be the changes surrounding the updates that we've just covered today. For the ECM CS CCM file, that's been in progress since December. Production date is May 2025. I believe for the MCPD file, production is scheduled for April 1st, and that will involve submitting March data. Another piece of information about testing, when you log in, the top directory is the test plans directory. Each plan is going to see basically their subfolders in the test environment. So the directory should look like, as shown on the screen, DHCS-paces/test/plans, Acme Health or your plan name, not Acme Health, but your plan name. And then submit is where you upload the test files to, and the response folder is where you will find our response files. Next slide. Oh, yes, a word on test sins. So for many of our training partners that have been working with DHCS for many years or several years, you will probably be familiar with the idea of test sins. They were originally created for testing the 837 claims encounter transaction, and it was there to allow trading partners to get past the enrollment eligibility validation portion of the code without any file rejections. Now that we are testing with JSON, things have changed a little bit. It used to be that we could get by with 5 test sins per plan. And one of the reasons the 5 tests in, or occasionally 10 tests in limit has been in place is that the team that creates and manages sins in general in the mainframe have limitation on their resources. More test sins means more maintenance, more resource. So they actually put that limit on us. In most cases, it shouldn't be a problem, but we did see recently with the PCPA file that when plans were trying to test more than 5 test sins and were repeating the 5 that were available, it resulted in rejections due to duplicates. So we do have a suggestion on that, which I'll get to. First, I want to just mention that many times using a test sin, you will receive warnings or other errors that do not result in a file rejection. So your file should complete the test to the end and be accepted with some warnings. And we advise, especially when it comes to the tests in part, disregard the warnings. They are not important in this case. The main thing that we're trying to help you do is get past that part without a file rejection. And one of the things that we've been looking at for JSON files is allowing trading partners to use dummy test sins, which can be created by our trading partners. And the only requirement there to avoid file rejection is to use the current accepted SIN format, which is 8 numerics and 1 alpha character, so that you have a total of 9 characters that you enter as a test SIN. When you do that, you will receive warnings when testing, but you will not receive rejections. So again, warnings can be disregarded. The main goal here is to get you past the rejections. And because JSON is a new territory for us, as well as for our trading partners, we are adjusting as we go. And looking at options that we can use to help you test more readily. So more to come on that, and more to come on testing in general with JSON files as we learn more. I just wanted to put that out there. Okay, now we can go to next slide. And again, for testing support, the Doc Center is where you're going to find the technical guides or companion guides, data dictionary, other files, ECM, CS, and MCPD questions can be sent to the EDM Data Support mailbox, and Doc Center is handled by the team behind the Data Exchange mailbox. Okay, next slide. And questions on what I've just covered.
Thank you, Jeff, for the presentation. I'm going to go ahead and go through the chats just to refresh and see if there's anything that's been missed. I just want to make sure you guys are still with me. Can I get a thumbs up or just mention in chat that you can hear me? Cool. All right. So going back, I'm going to start all the way back to Dale. To clarify, agreements type will no longer be required for appeals. Is that right? Kelly responded, yes, that is correct. Question from Kelly Bly. They don't see grievance type removed from the appeal record and the MCPD technical documentation from December of 2024. And then Jeff responded back, the document team will follow up with Kelly to ensure that the technical guide is clear and accurate. And then Serge responded back saying these changes are reflected in 3.05 version of the MCP technical documents, which has been uploaded to the DHCS documentation. I just want to verify which version they are using, or maybe they're using an earlier draft or not the final version. Amanda Heights asks, when will this slide deck be available? Amanda, usually about 2 to 3 weeks, but once everything's been finalized, we will let everybody know. Marlene Martinez, will the final MCP technical document be sent out to the plans? The one from December was listed as a draft. Swetha responded back saying the final MCPD technical document was shared with the plans on January 24th and is available in a documentation center. Sanjot has a question, when will the MCPD submission deadline for the new schema 3.05 to be going live into production, and when does it start? Swetha responded February 1st, 2025. It'll be in the PACES test environment. Let's see here.
And then production slated for April 1st.
Yep, cool. And then Kevin Janowiak asked, denial of payment request is one of the top grievance types. Looks like it's been removed, but aren't any obvious billing type options added as a grievance type. Kelly responded back, per the federal definition, this should be reported as an appeal instead of a grievance. Let's see, Armando asks, considering CLR data will begin to appear on providers' RTF files on or around August, should MCPs report null data until September? And looks like Janet Oto will respond back. You can always email the EDM data support and they will get back to you. Marley Martinez asks, in the MCP technical document version 3.05 that lists grievance types, community continuity of care will be changed to continuity of care, but it was not listed in the slide of grievance changes. Will this take an effect? Serge responded, yes, this is one of the for 3.05. Not every change was listed in the slide. Kelly Bly asks, changes to the MCP data elements, and she's listed a bunch of changes going down. These are changes listed, but does not see grievance type field is removed from the appeal record. Looks like somebody will get back to you on that one, but we will make note of that. May, part of our team, provided the link to the documentation center. There's that link below. Nolan Ing asks, would DHCS be open to discussing timeline for JSON phase 4 implementation? Just giving more details, and Janet will respond back. Just go ahead and email the EDM data support mailbox and they will get back to you. Portia Thompson asks, we received the final MCP version 3.05 on Friday. I believe, Jeff, you said that is the most accurate, correct?
Yep.
Okay. And then Lisa is mentioning that there are exceptions to the testing and new and updated files, and DHCS will provide testing criteria if expected or needed. Jeff, good job on your presentation. We got you. Nolan.
So many letters.
Yeah. Nolan Ing asks, we'd like to discuss the JSON file submission timeline. Gives specific dates, especially for the ECM and CS programs. Looks like, is that currently in discussion, DHCS team?
So, I think that's a program policy determination and probably will require a bit more discussion before we can give Noah a firm answer on that regarding the 10th. And he mentions resubmissions. I do want to point out there is a section in the MCPD 3.05 technical guide that covers resubmissions in case that is a question.
Okay. And then, just a reminder, the feedback you hear is due to lagging, and we are trying our best to minimize all of that. So apologize if you couldn't hear me earlier, but we should be good.
Yeah, and the last few questions, PCPA is going live on February 1st. There is I don't think there's a maximum number of test sins that can be used in a file. There are a maximum amount of test sins that are available from us. And that's why we are suggesting the option that was in one of the earlier slides. We'll make sure that we share those details further with the group so that that's clear as to what we are talking about.
Cool. All right, thank you guys. That seems like that's all the questions for now. Go ahead and feel free to put in the chat in a later time. Go ahead and on the next slide, please. Okay, so here is the communication section for the webinar. So here, this is all the data group mailboxes. I'm gonna go ahead and pause a little quick to have this up for a little bit, but here we have stuff on any information regarding 274 medical provider and encounters. That's the mailbox there. 274 behavioral health plans specifically, that's the mailbox. 274 dental, we also have behavioral health short dial, LTC PACE plans, DHCS documentation center access requests, any technical questions, especially for ECM, CS, CCM, and JSON is listed there. And any support you need for the webinar is listed on there. And just a reminder, any message that you guys send through email or electronic communications, please mark urgent either in the subject line or in the subject box provided. Next slide, please. Resources. This is a resources page that we have available. So basically for behavioral health and managed care, those are the resource emails and detailed description of the topics that you can ask for those resource emails. Jeff just put it in the chat. Any JSON formatted file questions can be sent to the EDM data support as well. Next slide, please. For dental managed care, there's resource emails, specifically topics such as dental providers and 837, Medi-Cal dental information, and dental managed care. Next slide. Okay, so for PACE, also known as Programs for All-Inclusive Care for Elderly Organizations, those are the resource emails and the topics that we'll cover for those emails. Next slide, please. Medi-Cal Managed Care Program. We have MCQMD mailbox, the MC Behavioral Health OMD mailbox, MCD PMV mailbox, and MCOD readiness. Michael Shafee just asked, I cannot access the documentation center. Who should I contact to fix this? We will get back to you on that one, or somebody will.
Yeah, Michael, we'll look into your account and see what's going on there. Again, with the Doc Center, you can always use that data exchange at dhcs.ca.gov email address. Since you brought this up, I see it, so I'll go check on it for you now and get back to you under separate cover.
Cool. Thank you. All right, next slide. And here, this is the resource email for the Medi-Cal Managed Care data quality, and also the specific general topics that you can ask for that mailbox there. Next slide, please. Encounter data quality mailbox is listed there below. And then any subject pertaining to this, you can ask to that mailbox. Oh, you're welcome, Michael. Next slide, please. All right, so technical support, of course, we have the data exchange mailbox, EDM data support, Cal AIM, ECM, ILOS mailbox, and the MC DSS mailbox as well. Oh, and Janet also put in the chat, if anyone has any trouble accessing the documentation center, please email the data exchange mailbox. Next slide, please. All right, so this is close to the end of the January 2025 webinar. Just a reminder, for February of 2025, we will focus on the quality measures for Encounter data, also known as QMed 2.0, Refresh Project and Encounter Data Improvement Project, EDIP planning efforts. The date and time is right there, February 26, 2025, from 10 a.m. to 11 a.m. Next slide, please. All right, so we come to the end, unfortunately, for January 2025. If anything, you guys have any other further additional questions, please send it to the MCDSS mailbox. We monitor this periodically, and we welcome any comments and suggestions at any time. Next slide. No, I guess that's it. So thank you guys for attending, and we will see you guys next month. Out.